Thank you for your patience and your attendance this morning. Oh, we've got our interpreters this morning. Good morning and thank you. This is a robust agenda, which is why the hearing room is packed. We're anticipating a relatively long hearing today. It will be my intention to give every member of the public an opportunity to speak. But it's also my responsibility as the chair of the committee to keep the trains moving, Senator Stone. I've got colleagues who have flights to catch and meetings. Senator Mining's already informed me that he's got a critical meeting on one of his pieces of legislation, so he'll be in and out. But our goal will be to be finished with today's hearing by 4 o'clock. That's going to be our goal, and I will rely on all of you, panel witnesses and the public, to try to help us all meet that goal by keeping your testimony concise and non-repetitive and relevant to today's hearing. Fair enough? Agreement? Beautiful. Thank you very much. With that, we'll get started with the Department of Rehabilitation, item 5160. First panel, please come on forward. This is all Department of Rehab. I'm going to hold all of the public comments to the end. So for the public's information, under Part A of the agenda, we'll do all of the public comment at the end of item number 4, which is the BCP. So you can, just line up one time and you can address all comments that you have relative to items 1 through 4 under Department of Rehab. And we'll go ahead and get started. Director Xavier, it's good to see you again. Thank you for being here.
Thank you. Good to see you again, Senator Mitchell, members of the committee. My name is Joe Xavier, Director for the Department of Rehabilitation. Today I have with me Teresa Corielli, our Administrative Deputy, Junie Lee, our Chief Deputy Director, and Molly Lotfalian, who is one of our planners who will be presenting in a few minutes. We provided a handout for the committee, but I'll just hit some of the highlights of what's in that handout for you. Our mission is employment, independence, and equality for all Californians with disabilities, and we achieve that vision by working with our stakeholders, our communities, and our partners in advancing our programs and services within the Department of Rehabilitation. As the Senator will recall, I've set a goal for the department of 20,000 competitive job placements annually at an average of $20 an hour by the year 2020, reflecting quantity, quality, and time. Vocational Rehabilitation Program is authorized under the Workforce Innovation and Opportunity Act, and it's overseen by the Rehabilitation Services Administration within the Department of Education. Our independent living program is overseen by the Administration on Community Living within the Health and Human Services Agency. Our vocational rehabilitation program is the largest in the nation. We serve 100,000 individuals annually, and the services are to secure, regain, or retain employment. We serve 12,000 individuals, over 12,500 individuals this past federal fiscal year that achieved employment. The services are to individuals with sensory, with physical, intellectual, and cognitive disabilities. We passed 5 of our 6 indicators from the federal government this past year, something that we're very proud of. For every dollar that we use, every state dollar that we use, we bring in 4 federal dollars. And we have about a $435 budget, 1,860 positions. Over 90% of the funds come from our Title I, our vocational rehabilitation program. We have 14 districts throughout the state, 13 regions, 485 offices and direct services through some 1,300 staff located throughout the state. Because we don't have sufficient resources to serve all example of the need that we have. We're in what's called the order of selection. Since the mid-1990s, we serve the most significantly disabled, and we were able to open up services to the disabled 4 times since 2011. Our independent living program serves over 23,000 individuals with disabilities, and they have provided over 69,000 hours of advocacy and education in our communities. The services they provide allow individuals to continue to live independently in our communities. There are 28 not-for-profit organizations that provide the services throughout all of the 58 counties. And their funding is 100% federal funding, including our program income, Social Security reimbursements. The Older Individuals Who Are Blind program provide specialized services to the blind and visually impaired over the age of 55. They serve 57 of the 58 counties, and they serve over 7,000 individuals annually. What's important to note about the independent living program as well as the Older Individuals Who Are Blind program, both are local assistance programs, meaning that we grant the funds to the local providers that then provide the direct services. I also would like to call your attention to the competitive integrated employment project that we have going on in a partnership with the Department of Developmental Services and the California Department of Education. And then, of course, we're in the midst of implementing the Workforce Innovation and Opportunity Act that reauthorized the dollars that we receive here in California for vocational rehabilitation. I'll stop my comments there or take any questions, and with the committee's permission, I can continue when you're ready.
Senator Monning, Senator Stone, any questions at this point? Senator Stone.
Well, thank you for your presentation. This department of the state of California is very important to me because it kind of hits home. I have a wife that has a traumatic brain injury, and so I understand the challenges that those that have traumatic brain injury often endure. And in looking through some of the literature, it seems as though about 1% of those that have traumatic brain injury and have SSI don't get back into the workforce. And I don't think it's because they're not capable of getting back into the workforce. I think many of them want to work back in the workforce, but there's this fear, and I don't blame them, because I've seen this fear with people that have come to my office as a county supervisor, that should they get training and get back into the workforce and find that a particular job may not be appropriate for them and they have to get back into the SSI program, it sometimes takes an act of Congress for them to resume those benefits. And so I think there are those that feel that risk that if they give up those SSI benefits and try to live on their own, which is something that I know you're encouraging, and I'm very complimentary to your achievement results of 12,500 people that you successfully gotten back into the workforce and coping with their disabilities. How can we give a secure feeling to those that have traumatic brain injury that want to get back into the workforce, want to be independent once again, without the fear that they're going to have to go through mazes of federal and state bureaucracies to get back on assistance if they need to?
Well, it's a great question, and I can certainly speak to that briefly, and as part of our budget change proposal that we're here for. And really, at the root of what you described is that fear. It's that fear of losing that safety net. And what the budget change proposal, and if the committee would like, I can speak to that, or wait till the agenda item comes up. But at the root of what we're asking for in this proposal is to provide the kind of information and education to the individual so that that fear is addressed, and so that they know the benefits available to them, including the ability to move back into SSI if that were appropriate and if that were necessary, without having to go back to square one and start all over again.
Director Xavier, why don't you go ahead into your second item, which is the overview of the traumatic brain injury program, and then we'll include the fuller answer, if that is okay with you, Senator Stone, in your presentation on the BCP, item number 4.
Thank you.
Okay, thank you.
Okay with you? So go ahead with your second item.
All right, thank you. So The agenda does a great job of describing the TBI, traumatic brain injury program, but just a couple of highlights. We have released the request for application, the proposal for continuing the services that we have had in place for some time. The applications are due the end of this month. And this process has included community engagement at all levels. In fact, tomorrow we are holding a bidders conference for those that are interested in submitting proposals. And we are planning to award 7 grants with the available funding. The existing waivers are being used to meet the waiver services requirement and to provide the services to this population within the services available in that waiver. It's important to note that an individual is eligible for only 1 waiver at a time, and that we continue to engage with our partners at the healthcare services to add any services that are necessary and appropriate for the TBI population. And we certainly continue to work with the community to make them aware of the waiver services, and of course that will expand a broader reach for those that need those level of services. I'm going to turn this over to our Chief Deputy Director to talk about the one-time allocation, some of the more specific information around funding.
Thank you.
Actually, Teresa Coriali, Admin Deputy, I'm going to cover that part about the fund. The fund condition statement is, of course, prepared by the Department of Finance, and it only includes projections through the year 2015-16. So based on those projections and projecting out another couple years, the fund includes approximately $1.4 million right now, with expected expenditures in the range of $1 million this year. Revenues are still decreasing. They're decreasing at about a rate of 3% per year, which would leave us at about the $750,000 expected revenue by in the out year. The new grant cycle, the programs will be granted the money based on the amount of resources that are available, and they're expected to receive approximately $120,000 each for the 3 years. The average grant currently is anywhere from $110,000 to $150,000. So they vary. So just somewhere in the range of what they're currently receiving, they'll receive over the next 3 years. The department continues to pursue other funding sources. We did apply for a grant from the Health and Resources Services Administration in 2014, but we weren't successful in that grant application. We are registered for funding opportunity notifications and regularly search 11 government sites, 4 private foundations, and other private entities for grant opportunities. We're seeking opportunities to partner with other entities that already have TBI relationships, including boating and waterways, alcoholic beverage control, even the National Football Association. So we continue to pursue every opportunity to increase those fundings.
And what do you think is the likelihood of, by the end of the 3-year period where the funding is currently available, that one of those other sources will come to fruition? Highly confident, unsure. What do you think?
You know, it's a bit of a Ouija board, and I must say that. You know, I would just say that, you know, our experience to date has been what we've described. We've applied for a grant and we haven't received it. We'll continue to look for every opportunity, but I certainly couldn't offer a degree of certainty one way or the other.
And so then I guess in the next year or two, we'll have to then begin to have conversations about, you know, if not private grant opportunities, then what? In terms of maintaining the program, we'll begin to look at a plan B, C, or D option?
Well, as we've said, we're certainly committed to continue to pursue the funding, and obviously the legislature's been great partners with us when that has come before you.
Okay, why don't you move on then to item number 3, the update on the California Promise Initiative.
Good morning. I'm Junie Lee, the Chief Deputy Director for the department, and it would be my pleasure to provide you an update on our Promise Grant. The Promise Grant stands for Promoting the Readiness of Minors in Supplemental Security, and it is a grant that was a collaboration of 4 federal agencies, the Health and Human Services agencies, Social Security, Labor, and Education. And the grant really was to provide a study. California received $50 million over 5 years, so $10 million a year. And California's received the largest grant out of the 6 projects. We, to date, have enrolled 1,000 of the over 3,000 that's required for this study. As you know, there are approximately 115,000 youth under 18 on SSI. On our roles in California between the ages of 14 and 16, which is the age group for this study, there's approximately 22,000 in California. And the department last year was given the approval to hire 6 full-time positions. Those positions have been hired and filled and actively working on the grant. During this time as well, we have worked with our sister departments, the Department of Social Services, the Department of Developmental Services, Healthcare Services, Education, and EDD. They are on our advisory committee for this grant. We have developed 21 contracts with our local education agencies, and they represent over 300 schools. We have also hired 65 career service coordinators. These are the individuals in the schools that will be working with the youth and the families. We have trained the career service coordinators. They've gone through security clearances. We've gone through our IRB. And so there's been a lot done in this first year. We've, as I mentioned before, enrolled about 1,000 of the over 3,000 were required to enroll. And that represents about 30% of our goal. I'd like to share that we are ahead of any other project in terms of the numbers of enrollments. So we feel that we're doing rather well. We have recently met with Mathematica, who has been hired by this project at the federal level to evaluate this grant. And their note to us was that they were really impressed with our model in that we are working with schools and we are not having the issues that some of the other projects are having with recruiting. What we also have done to really, I think, stand California apart is that we've added university interns, 31 interns, to work as conduits between the school and the VR program. The 14 and 16-year-olds are not typically served in our VR program. So these interns will play a really valuable role.
And let me make sure I understand that the total population of the 14 and 16-year-olds that the program is geared to help is the 3,078 number?
That's the requirement for the study, yes.
Got it, okay.
One of the things that we really are finding is that this Promise study is really in tune with our efforts in California for competitive integrated employment, promoting employer engagement, as well as aligning with WIOA and with our own BCP, our work incentives planning, because core to the services we're trying to provide the youth and the family is information about work incentives. We find that the early intervention will make the difference between whether these youth will stay on SSI or they will advance through education and into a career. We think that this study really provides us, California, a great opportunity for public policy around VR and who we will be serving. So we're really excited about the grant.
Senator Stone.
Thank you, Madam Chair. Thank you for your report. I really appreciate it. And 115,000 individuals, youngsters, are enrolled in the program now, and according to the literature, about 60% of those will remain on SSI. unless we find out a better way to take care of them. And it sounds like to me you're doing some very innovative things and bringing interns on, which I think is an outstanding idea. But with regard to the pilot study, could you just define a little bit more what a positive outcome would be? Obviously, being independent and finding a job, but I assume that there's other measures of those positive outcomes. I assume educational assistance, life skills, which is very important. I believe that your department can have a tremendous effect, and I think that we can lower that 60% with the talent that I see around the table. And I certainly, over the next 4 years that I'm here, want to work with you and make sure that we do everything we can to let a lot of these people that want to live independently in spite of their disability move forward. So tell us more about the positive outcomes and what you'd like to see.
Thank you very much, Senator. I think you've hit it in a couple of areas. We really are trying to provide education to the youth and the families so that the youth have desire to look for post-secondary opportunities, whether that be college or vocational training. We're also trying to provide work experience, and we're trying to provide self-advocacy and information and knowledge of what is out there in terms of opportunities. So it is all to support that self-sufficiency, and you're right, there's just too many folks leaving the SSI roles, and I think the director has said it's less than 1%. And we're trying to make a difference. We think the early intervention is something innovative. I think the fact that you have 4 federal agencies coming together wanting to study this to make a difference is very significant. And we're really proud of the fact that California is being looked at not only as already making a positive lead in the study, but looked at some best practices. All of our career service coordinators are certified through Cornell University to provide this work incentives planning. And it's pretty intensive, the type of training, we call it a boot camp that we put people through. But, you know, it's all worth the investment. I believe in 5 years we're going to have tremendous opportunities. I
agree with you, and I applaud the work that you're doing. And again, I'll go back to that. I don't believe that the number of 1% or less of 1% aren't able to move forward into employment. I think that there's a lot of fear that if they leave the system, they have to fight to get back in the system. So there needs to be some process, streamlined process, that if for any reason they maybe take a job that may be too challenging for them at that point in time, that they can get back into the program quickly and have the assurances that they can get back into the program quickly. And I'll guarantee you that number is going to go up, because I think a lot of these people really do want to go out and work, but not at the expense of having the fear that they're not going to have their monthly stipend to eat and live. So
we agree. Thank you.
Thank you. Let's move on. If you're done on this program, thank you. Let's move on to your final item, which is your BCP, the statewide funding of Social Security Beneficiary Work Incentives Planner.
Thank you. What we're asking for in this BCP is 31 positions and $3.1 million of authority so that we can provide services here. And I'd like to touch a little bit on the background. I think Senator Stone is very astute to the issues that are faced here. The unemployment rate for the working age individual with a disability hovers around 70% persistently. Only 31% of that population is participating in the workforce as compared to 75% of the non-disabled population. And as we mentioned several times, half of 1% are leaving those roles, and I'll touch base on some of the work that we're doing to change that, Senators. The complexity for work incentives planning certainly has increased over time, and we have now reached a point where we want to refocus the efforts on changing these numbers. And Senators, I am an individual with a disability. I have the personal experience of having been on SSI. I benefited tremendously from it. I also benefited tremendously from leaving the SSI roles and moving into employment, and we want that for every individual that we serve. The State Rehabilitation Council is established in statute to advise us on our programs and services, and they've been working with us for some time for us to improve the incentives, work incentives planning that we provide to our consumers, and our schools are very supportive of the approach that we're taking. Why are we doing this? We frankly need to change these numbers, and Senator Stone, you're right. Many more people need to go to work, but to change those numbers, we need to do something different. We need to take a different approach, and this budget change proposal does that. The Workforce Innovation and Opportunity Act that I alluded to earlier places a stronger emphasis on more individuals with disabilities going to work. And one thing that I want to be sure that I mention to you here is that in work incentives planning is not new to vocational rehabilitation. We have traditionally provided it. But what we're looking to do here is have a dedicated, focused effort on that. We want that to be integrated into the conversation around vocational rehabilitation and the individual going to work. So from day one, when I as a consumer show up to the doors of the Department of Rehabilitation, we start having that conversation about how to address the very concerns that Senator Stone is speaking of. And the conversation needs to be focused on work, it needs to be focused on leaving poverty, and it needs to be focused on sustained self-sufficiency so that people can reduce their reliance on public benefits. We tested this through using our temporary blanket positions, and 10% more of the population that we serve went to work. But more importantly, we doubled the number that went to work at a wage sufficient to move off of public benefits. In California, we have on SSI and SSDI over 1.7 million Californians. On our caseload alone, we have over 40,000 individuals who are on SSI, SSDI. We certainly recognize that there are some stakeholder concerns, and the independent living communities have been long-standing, strong partners and will continue to be so. While the ILCs are funded with the same funding stream, these two issues are not linked. Continued funding of the ILCs and funding these positions are not linked. The $3.1 million of authority that we're asking for, those are not dollars that exist. Without this change, this proposal being enacted, there is no $3.1 million. And the SSA, the Social Security Administration, has had a program in place for work incentives planning since 2006, and yet the fear that Senator Stone spoke of and the numbers that I alluded to persist. What's important also to recognize here is that the proposal does not risk funding for the independent living community that is set in the budgetary statutory languages. Finally, the outcome is really what's at heart here. More individuals with disabilities who are on SSI go to work, they become taxpayers, they leave the public benefits role, and they enjoy independence and quality in their community, and there's no cost to the state. In the handouts, there are some consumer stories that we would invite you to take a look at. And Molly is here. I would like to have Molly share with you some of the more specific information around the work that she does, and then as well as some of the consumer's perspective that she has been working with. So Molly, if you please.
Thank you. Good morning. My name is Molly Lutfallian. Thank you for the opportunity to speak with you today about the Work Incentive Planning Pilot. I am the Department of Rehabilitation's Work Incentive Planner, and I cover the Sacramento District. I cover 7 of the branch offices located in the following counties: Sacramento, El Dorado, Sutter, Butte, Lassen, and Modoc. Like all of the work incentive planners at the Department of Rehabilitation, I too am certified by Cornell University's 17-week-long Work Incentives Practitioners Credentialing Program. The role of the WIP is to assist job-ready SSI and SSDI consumers to understand how employment will interact their cash and health benefits. We also address the fears that SSI and SSDI consumers have about going to work by providing them with accurate information on the various work incentive programs available to support their employment efforts without losing their benefits prematurely. Work incentive planners provide services in collaboration with vocational rehabilitation service delivery team. We have daily contact with the vocational rehabilitation team, whose members include counselors, service coordinators, and employment coordinators. We're a valued resource for work incentives and benefit program knowledge. We coordinate consumer referrals, communicate consumers' progress, and provide pertinent information regarding the consumer's benefit status. We follow up with the consumer and the team at critical touch points and communicate any issues that may arise. This would not be possible without the work incentive planners being integrated into part of the vocational rehabilitation team. So next, I'd like to share with you one example of how the department WIPs have impacted one of our consumers' lives. So I'll share a success story, if I may. And for the purpose of this story, we've chosen the name Shauna to protect the consumer's identity. So the story is about a woman named Shauna who came to the Department of Rehabilitation in 2012 after attempting to pursue employment on her own. When I met with Shauna, she was collecting $877 in SSI. Shauna shared with me that she desperately wanted to work, but she was very concerned about her health care coverage, specifically Medi-Cal, because her medical conditions included kidney disease, heart disease, and dialysis. In addition to her concern about losing her health coverage, she also was concerned about an overpayment, which she had acquired years prior when she attempted working on her own without the support of a DOR counselor and work incentive planner. So through working with Shauna, I was able to provide her with the information on a work incentive program that would allow her to keep her health care coverage while she was working, a program called the Medicaid While Working, or also known as the 1619B program. 1619B is a program that allows individuals on Social Security to earn up to $37,000 a year and still qualify for their benefits. In regard to Shauna's overpayment, we were able to file a waiver, and we were able to reduce the amount that she owed from several thousands of dollars down to several hundreds. Shortly after my initial meeting with Shauna, I learned from one of our team members at the Department of Rehabilitation, our employment coordinator, that Shauna was offered employment. She was offered and accepted employment with the federal government. So she was offered a salary of $2,800 a month, which included full health care benefits. So Shauna was able to keep her health coverage provided by Social Security along with her benefits provided from her new job. The impact of this was that although Shauna's earnings were too high to receive her SSI payment, she didn't lose her SSI eligibility. She's now earning significantly more money than she did when she was living on SSI alone. In fact, $1,900 more per month. So instead of living on $877, she's now taking home more than $2,800 per month. The most important piece was that as a work incentive planner, I was able to alleviate Shauna's fears and provide her with the tools and resources that she needed to make an informed choice about going to work. Today, Shauna is very proud of where she works. She's happy to have such great health coverage, a great monthly income. She's happy to be paying into the tax system, and most importantly, she's moving out of poverty. Thank you.